a lot of pain here. I need my drug. Stop delaying
He needs his Demerol. Ready? Hi, it's Debbie. I'm doing my parental video demonstration. So before I get started, I'm going to go ahead and check my physician orders and apply PPE as necessary. So I'm going to go ahead and introduce myself, put sanitizer on, and provide privacy. Hi, I'm Debbie. I'm one of the nursing students working today. I do have some pain medication if you think you need it. Can you tell me your name and date of birth, please?
My name is Joseph Smith. I was born October 5th, 1953, on a stormy night.
Of course it was stormy. They always were. Joe, do you have any do you have any allergies? Do you have any allergies? Sulfa. Okay. None of the medications that I have for you today contain sulfa, so you should be good. Can you tell me what you're rating your pain at?
Oh, about an 8.4.
8.4. It's way up there. Okay. That's a lot of pain. And do you know when the last time you took something for pain was?
At least 8 hours ago.
Perfect. Okay. I'm gonna go ahead and check my physician orders with my MAR. So for pain rated, it says on my physician orders that he has Demerol 100 milligrams IM every 4 hours for pain rated 5 to 10. And on the MAR again, he has Demerol 100 milligrams IM every 4 hours for pain rated 5 to 10. So that's perfect. Put that down. The 3 places that we would give an IM injection. The first one is the deltoid, and you find that by putting your pinky on the acromion process, and then 3 fingers down. I'm gonna make a imaginary triangle, and it would be like right in the middle of that triangle. The vastus lateralis is you put one hand on the greater trochanter and one on the upper femoral condyle. Split that in 3 sections and kind of cut that in half, and it's going to go in that middle section right there. And we primarily just use that for infants and little kids. And then the third one, and I'll show you that when we go to do it, is the ventral gluteal muscle. So, Joseph, I want to tell you a little bit about the medication that you're taking. It's called Demerol, and you're getting 100 milligrams in a muscle, and you can take that every 4 hours for pain, rated 5 to 10. So, because you rated your pain at 8.4, we can go ahead and give the stronger medication. And how this works is it alters your perception to pain and helps you really not care about the pain anyway. So some common side effects you might feel are confusion, a sedated effect. If you take it for a while, you might have some constipation, and it might make you nauseous. So if you're having any of those, you need to let us know because we can help treat those as well. Some serious side effects that we need to watch for is it can cause respiratory depression, low blood pressure, and urinary retention. So again, we're going to be monitoring your blood pressure and your heart rate, or your respiration rate, to make sure that you're still breathing okay. It takes about 10 to 15 minutes for this to start working, so you should start feeling it pretty quickly. And based on Joseph's size, I would be using a 1.5-inch needle and a 25 gauge, because he doesn't have a lot of extra fat, so a 1.5-inch needle should be about perfect. So I'm going to go ahead and open up my packages, and I'm going to use a blunt tip needle to drop the medication.
Increase the pain.
I also would be putting gloves on before I get the shot. So I need to fill the syringe with the 1 ml, because that's how much he's getting, of air. And I'm going to check that my package is intact, that it's not past the expiration date, and then clean the top of it for 30 seconds because we want to make sure it's clean and that we're not putting anything into the solution. So 30 seconds. You know, you look good for having 8.4 pain.
I'm really tough.
Yeah, you are. Okay. So that's been about 30 seconds.
30.
So I'm going to go ahead and remove my cap to my blunt needle. And I would have something harder, but this will work. So go ahead and inject that air into the vial. And then draw it up. Make sure there are no air bubbles. And then I'm going to go ahead and perform my first check. So I have Demerol 100 milligrams IM every 4 hours for pain, rated 5 to 10. And here I have Demerol 100 milligrams per 1 ml. So that looks good. And then I would have a second nurse verify. We're just going to pretend. It's okay, you don't have to do it. We're just going to pretend that we had a second nurse verify it, looking at the orders. So that's the second. And then after we do that, I'm going to go ahead and do my second check. And I have Demerol 100 milligrams IM every 4 hours for pain rated 5 to 10. And here I have Demerol 100 milligrams per 1 ml. So that was my second check. The 5 rights to medication: right patient, right medication, right time, right dose, and right route. So then I'm going to go ahead and do my third check. Demerol 100 milligrams IM every 4 hours for pain rated 5 to 10. Demerol 100 milligrams per 1 ml. So that's perfect. So I'm going to go ahead and remove the blunt tip because I would never give a shot like that. Being careful to recap to maintain sterility. And I would have, there we go. And then I'm going to go ahead and throw that in the sharps container. Oh, he's in a lot of pain. And then I'm going to go ahead, I'm going to not actually put a needle on here, but again, maintaining that sterile technique, I would put it on this way, not touching anything. So, my needle would have a cap on it, so we're all good. It's all sterile. So, Joe, can I have you roll over onto your side for me? I know you're in a lot of pain. So to find that ventral neural site, I'm gonna put my hand. Go ahead and relax best you can. My hand, my palm is gonna go on the greater trochanter. My thumb pointing towards the groin. My finger towards the iliac crest. My index finger towards the iliac crest, and my middle finger towards the iliac spine. And that's where I'm gonna go, is in between my ring finger, or my pointer finger, and my middle finger. So I'm gonna go ahead and clean that in a circular motion till it's nice and clean. And I'm actually gonna leave you can relax your muscles, because otherwise it's gonna hurt more if you're wiggling around. So I'm gonna go ahead and stick the needle in, aspirate up, make sure that there's no blood, and go ahead and inject the Demerol. And it's, you have to go kind of slow, so it's about 10 seconds per 1 ml. So this is going to take about 10 seconds. 9, 10. And again, I'm just going to let that sit there for about 10 seconds to make sure it all gets absorbed into the muscles. And I did use a Z-track technique, so I did kind of pull down into the side when I did that to make sure that it keeps it into the muscle. So after 10 seconds, I'm going to go ahead and lock my needle.
Fast as 10 seconds.
I know. And then I'm going to hold a 2x2 gauze on that site for, again, about 10 seconds. And I would dispose of my needle in a sharps container, making sure that it's locked first. 10 seconds. Put a Band-Aid on if it needs it. Probably won't after that long. This would go in a sharps container again. Joseph, is there anything else I can do? It must be working already. Is there anything else I can do for you, Joseph? Okay, he's good. So I would go ahead and wash my hands and document as appropriate. And on my MAR, I would write the time and my initials that I gave the Demerol. I think that's about it.